Well, for more on the pandemic trends, Dr. Lara Roberts, a public health physician, joins us via Zoom. Welcome to the program.
Hi, thank you for having me. Good evening.
Good evening. Zero COVID-19 related deaths for more than a week. This is good news, isn't it? And most importantly, how do we maintain this zero deaths with the almost 8,000 active cases that we still have in the country?
It certainly is very good news, and we cannot say that we know totally why that this is so, but we are very, very grateful that it is. We do still need to keep up with the public health interventions of keeping a distance, keeping the numbers that congregate together in closed spaces much lower, keep with the hand washing, hand sanitization, and as much as possible wearing masks in closed public areas. One thing we do have to remember is that as we loosen the public health interventions, we run the risk of increasing the rate of transmission of the virus. And then we start to see an uptick in the number of cases. So far, we want to keep this going, and we can only do that by maintaining our public health interventions.
Are you worried that we're not testing as we should be when you see the recent infection numbers in the last couple of days? And there's also the question of the rapid test kits and who's using it in the country.
Well, we certainly are not testing as much as we should, but the thing is that, as you well know, the PCR test is a very involved and complicated test, and it's also extremely expensive. So to continue using it as a first-line testing method is not actually economically viable at this stage. It is much better that we use the rapid test kits and get them out as fast as we can, particularly to areas where they'll be very useful, travel places, airports and places like that, where people need to be tested so that they can go into an aeroplane or get into a certain venue and things like that. That is something that will certainly continue to make sure our numbers remain low.
Another question also is, our reports today from Yobe, for example, show some people who might mix up symptoms of COVID-19 with other diseases like tuberculosis. I mean, what are some of those common ailments that share similar symptoms with the coronavirus?
Well, tuberculosis is certainly a key one, but even more commonly is malaria. I mean, the symptoms of COVID-19 do very much mimic the symptoms of malaria. And then you've got people who insist that they've got malaria, insist on treating malaria, indiscriminately using anti-Artemether combination therapy to treat malaria. And, which then means that they are not quickly getting into the proper care that is needed for COVID-19. Now, it's okay this is not okay at any point, but if they don't develop symptomatic COVID, okay. But if they do, it means that often they're too far away from effective healthcare at the time when they need it, at the time when they start developing breathlessness or dyspnea. And certainly where they're mixing it up with tuberculosis, the issue is that we still have a huge problem with tuberculosis, multi-drug resistant tuberculosis. We're still one of the countries with a high rate of tuberculosis cases that need to be on constant management. So we have to encourage more people to come in to make sure that what they have is not COVID or is tuberculosis, so they can get them into treatment.
Finally, before we let you go, do you agree with the WHO DG when he said that the world has the tools to bring the pandemic under control if applied consistently? And if we say one of those tools is vaccination, I mean, look at where we are in Nigeria with vaccines.
Well, certainly I will agree with the DG of WHO. We now have some tools to bring the tools to bring this infection under control. We certainly can drop the rate of transmission with the non-pharmaceutical public health interventions. They are working. We know they work. Every time you loosen those interventions, we get a spike in cases. And we're also running the race, as we say, between infection and injection. We need to get a lot more people vaccinated so we can achieve herd immunity. There's no magic number, but certainly we need to have vaccinated over 70% of the population to be able to say that we're even on the road towards herd immunity. And while we are struggling to achieve that, we need to keep up with the non-pharmaceutical public health interventions. What people don't realize is that the longer we allow the infection to run through human beings, the higher the rate of mutations we get. And the danger is that we then run into some kind of variants and mutations which are now not, if the vaccine is no longer effective against. So we must keep the rate of transmission down using the non-pharmaceutical public health interventions.
We appreciate your time.
And we have it.
Thank you so much, Dr. Larry Roberts, public health physician. Thank you for joining us.
Thank you for having me.